If you want to talk about staying young, staying healthy, then we are talking about stopping aging. In order to stop aging, we have to first of all understand why we are aging. It's actually a bit different than we think. Here, I will show you a picture of a person whose CTs have been taken at the age of 25 and then at the age of 50. So if you compare these two CT scans, you can see a radical difference in the midfacial bones. Basically, what is aging is the resorption of the midfacial bones backwards. So the skin is not sagging on itself, but because the bones go backwards, the skin goes down. More interesting, this resorption of the bone is not uniform. There are specific areas of the face which are resorbing more, like the lower part of the lower eyelids, which means like the midface, and the lateral sides of the mandible. That means in order to stop aging or reverse it, we have to put that volume back. In this sense, we are having three different choices. We can use fillers, we can use fat injection, and we can use stem cell therapies. So if the patient wants to have a fast solution, these areas of resorption, which is the upper midface and the lateral sides of the mandible, can be filled with a filler. The advantage of that is it takes maybe 2 minutes, it is very fast, and the patient directly goes to her or his normal life. But of course it's limited because of the fact that we are using 3 cc's, 4 cc's at most, and it is resorbable. So after 6-7 months or a year, you will not have anything left. A better solution is to use the patient's own fat. In this procedure, what we are doing, again, actually it's not a surgery, we are taking the fat from the patient. It takes around 10 minutes. And then we are injecting those areas of the midface and the lateral side of the mandible with the patient's own fat. This is done under local anesthesia or sedation. We are just using needles in order to get the fat and to inject the fat. And it takes around 15 to 20 minutes. The advantage is it is stable and it will remain there. So it is an everlasting solution. But of course the problem is the patient is going to be swollen a bit, like up to 3-4 days. People can recognize that there is some sort of swelling on the face. The best or the ideal solution of stopping aging is usage of the stem cells of the patient. So in this operation, we are taking the fat of the patient. We are separating the patient's stem cells out of the fat and injecting these areas with the patient's own stem cells, which means the regenerative cells. The advantage of this procedure is you will actually compensate this devulcanization, but then on the other hand, or at the same time, these cells, what you inject to the face, are going to make the skin and the midface younger. So we are correcting the volume problem. At the same time, we are making the skin younger and younger. So these three options are the first row of fighting aging.